I'm Karen Ashforth. I'm an occupational therapist and lymphedema therapist. Today's presentation is about an exciting combination of two great types of treatment for lymphedema swelling and fibrosis and how they can work together. For those of you watching who have lymphedema, I would strongly urge you to consult with your treating physician and your lymphedema therapist if you want to follow up with any of the material presented today. Each person is unique, and these treatments are intended to be individualized depending upon each patient's distinctive presentation of symptoms. There are 4 stages of lymphedema, which describe how severe it is. The first stage is called latency, or stage 0. This is where there may be congestion, but it is barely noticeable. There may not even be a difference in size, but there is more fluid, sort of like a sponge that becomes saturated. It doesn't get bigger, but it's heavier and more full. Stage 1 is called the reversible stage, and in this case, elevation will reduce swelling by means of gravity, directing lymphatic fluid downhill. There can sometimes be pitting, in which pressure to the skin will leave an indent. Stage 2 lymphedema is called the spontaneously irreversible stage because at this point, tissue has undergone some changes and has become harder. In stage 2, swelling is not as successfully controlled by elevation. Lymph has gone from being liquid to a more solid-like form. Without treatment at this stage, tissues can continue to change and become harder. Volume can increase, and it can become more difficult to decrease. And lymphostatic fibrosis occurs. I'll talk more about that in a minute. Stage 3 is overall less common than the other stages. It is called elephantiasis and refers to tissues that have undergone tremendous change, leaving the body significantly larger. Let's discuss fibrosis. Fibrosis is a change in the tissue fibers. When the body has some type of trauma or chronic swelling, the tissues gradually change and become harder, denser, and less pliable. Wrinkles can disappear, but not in a good way because the skin becomes less elastic and the tissue is filled in with hardened matter. Fibrosis often occurs in surgical scar formation, and scars can become thick and hard. It also occurs in many people after radiation treatment, when tissues can become harder and more brittle. People who have had cellulitis infections can sometimes develop a residual hardness in tissues that were affected by the infection, particularly if lymphedema is involved. So to describe fibrosis as it relates to lymphedema, I would divide fibrosis into 2 categories, hard and harder. The hardest type of fibrosis is a scar-like and formed as the body heals after surgery, radiation, or a severe localized infection such as cellulitis. It can affect the surface of the skin, but can also go deep into the tissues. It can obstruct lymph flow and compound lymphedema. The least hard type of fibrosis is called lymphostatic fibrosis, and it is actually created as a result of the congestion itself. When the swelling is present for periods of time and is not decongested, the cells form a matrix that actually adds tissue to the body. This tissue forms a layer under the skin and literally creates a larger arm or leg. It can also form on other parts of the body if there is chronic persistent swelling, such as the armpit, chest, shoulder, or back. The areas that are affected by fibrosis will especially need decongestion to prevent a snowballing effect of further swelling, fibrosis, and hardening of tissues, and ultimately greater damage to the lymphatic system. Fortunately, special treatments and compression garments are available. Today, I will show you 2 components, decongestion and compression, that each work well on their own, but also work well together. These are pneumatic compression and quilted foam compression. I really find them effective used together to obtain good reduction in patients who have fibrotic lymphedema. This is a great little technique from my therapist's tool bag, and the results are really wonderful. I use it on many of my patients who have hard fibrotic tissues. One caution that I would not use it with patients who have just completed radiation and have ultrasensitive skin. Pneumatic compression with LymphaPress applies both massage and compression. It has multiple inflating chambers that will actually create a massage wave that milks the edema and helps it to move out of the swollen area to healthy areas where it can be absorbed and processed in the lymphatic system. The pressure can be adjusted from light to intense. The amount of pressure should be determined by patient need and tolerance. For most patients without fibrosis who have soft swelling and simply need decongestion, I generally use compression settings between 40 and 50 millimeters of distal pressure. For those patients with harder tissues, higher pressures are more effective and better tolerated, and I use levels of up to 60 millimeters of mercury. In rare cases, I might use compression of up to 80 millimeters of mercury. As you select the level of compression to use, keep in mind that the amount of pressure on the feet in deep water exercise is over 100 millimeters of mercury, far greater than I use with pneumatic compression treatment. Also keep in mind that in aquatic exercise, both legs and trunk are being decongested all at the same time. I like using pneumatic compression because the massage action is very consistent, and if I set up a particular program for a patient, I know they will get exactly the right treatment each time. The garments are very easy to apply. I find it to be very effective on patients in my practice. And this is what I call a reduction modality because the treated area will reduce quite rapidly. Now, to maintain results when the patient is active during the daytime or sleeping at night, the area needs to be compressed. For this, we use what is called static compression. JoviPak garments are a great method for static compression. They are easy to wear and they apply a very comfortable low level of pressure. Although the majority of my patients wear Jovi garments at nighttime when they are less active, I have a number of patients who find them so much more comfortable and effective than other types of static compression that they wear them during the daytime as well. What is special about the JoviPak garments are the foam chips that are quilted inside each garment. They stimulate circulation with a subtle massaging action that can occur even with micro movements during sleep. The uneven texture of the foam and the quilting lines create a negative space to channel lymphatic fluid out of a congested area to a healthy area. This discovery isn't anything particularly new. Foam chip bags have been used for decades under short stretch bandages to treat fibrosis. The varying degrees of pressure created by the foam chips under the pressure of the bandages as the patient moves around soften the fibrotic tissue. JoviPak has taken this concept and created a wide variety of garments for any part of the body. I have found that using these two methods, LymphaPress and JoviPak together, is especially effective for patients with fibrotic lymphedema. The multiple chambers of the LymphaPress, with the Jovi underneath, produce what I call three-dimensional compression. What I will be showing you is how to use the LymphaPress device instead of bandages. We will use it to exert the pressure and movement on the JoviPak underneath to apply the treatment to the fibrotic area. We've had excellent clinical results with this method. I let my patients know that it is a fast-track way of dealing with fibrosis. I find it works well for patients who need an aggressive jump start for fibrosis, as well as those who are just beginning to develop hardened tissue and need to stay on top of it to prevent progression. Of course, the patients can also use each of these systems separately when they want. They can use the LymphaPress alone and wear the JoviPak the rest of the day. Now, before we get started, let's review the contraindications for compression therapy with a pneumatic pump. These are pretty much the same as those for bandaging and manual lymph drainage. Here are the ones listed by the LymphaPress manufacturer. Known or suspected deep vein thrombosis or pulmonary embolism during the inflammatory phlebitis process, acute infection of the affected limb, decompensated cardiac failure, severe arteriosclerosis or other ischemic vascular disease, any circumstance where increased venous and lymphatic return is undesirable. Due to movement of fluids in the body when using the device, it is important to exercise caution with patients who have heart disease. High pressure is not recommended for patients who have peripheral occlusion disease. And the abdominal area should not be treated during pregnancy. It is also important to note that LymphaPress pneumatic compression systems are only available with a doctor's prescription. Now, I'd like to show you some examples of LymphaPress pneumatic compression and JoviPak garments working together. The first example is a LymphaPress Petite Basic system, which has a sleeve that fits over an arm. You can see my model is pulling on her Jovi arm garment easily, and the pump sleeve just slips on over that. You can see she doesn't use a Jovi jacket while using pneumatic compression, because the pump gives her much more compression than the jacket. Here is another example using the LymphaPress 201 Max system with an arm sleeve over a Jovi. My patients who use the LymphaPress arm sleeve over a Jovi garment are treating arm swelling only and love that this is a compact and simple system. However, when there is also trunk swelling, patients need to use a different system that is larger and treats the torso as well. I'll show you that in a minute. But because this system focuses only on the arm, I think it's important for my patients to perform some manual lymphatic drainage while they are using the system, just to make sure fluid gets absorbed properly once it's moved out of the arm and doesn't create problems in the trunk. Here is another example of arm decongestion using the LymphaPress Optimal with Comfy Sleeve over a Jovi vest arm combination. This is a much more comprehensive treatment because it not only decongests the arm, but the axilla, shoulder, chest, back, and abdomen. This is the best choice for patients who need to treat swelling in their torso as well as their arm. Even though the Jovi and LymphaPress garments cover more territory, they are both still easy to put on, take off, and easy to adjust to fit. The Optimal is also very easy to operate. One feature that I think is particularly wonderful is that my patients can always lower the pressure if they feel they need less. And it is very easy for me to reprogram it for them if needed. Moving down to the lower body, the next combination I'd like to show you is the Petite Basic system with Jovi leg sleeves. Again, see how easy it is to put on both the Jovi and the LymphaPress leg sleeves. The LymphaPress leg sleeves come in a variety of lengths and widths. The Jovi leg sleeves do as well, and any Jovi garment can also be custom made. Although these can be used with the legs resting on the floor, patients get better results if their legs are elevated either on a recliner chair, a couch, or a bed. One thing I recommend to my patients is that they choose a place in their home where they can do their treatment each day. To make it easiest, the ideal would be to leave everything set up so it's ready to go. Here is a more comprehensive treatment using the Optimal and LymphaPants over a Jovi boxer and leg sleeves. This treatment addresses leg swelling as well as abdominal, hip, and genital edema. The LymphaPants have 3 different zippers on the side, which makes it very versatile and is particularly useful if one leg is a different size from the other. It's important to remember that the LymphaPress appliance needs to be a little larger when it is used in combination with a Jovi garment. So if it is difficult to close the LymphaPress appliance over the JoviPak, use a larger size or add a zip-in expander. And for patients who need something that is a lot larger, the LymphaPod is specifically designed for the bariatric client. This has been a real godsend for many of my patients. The LymphaPod has a lot of adjustability and is surprisingly easy to get into. Because JoviPak routinely makes custom garments, I get the right fit for my bariatric clients. For patients with genital edema, a Jovi genital pad can be used under the LymphaPod for added compression. We generally perform a trial with this equipment in the clinic for around 30 minutes. For home therapy, I generally recommend a treatment time of 60 minutes once or twice a day. After I do a trial treatment in the clinic, I have the patient remove the LymphaPress and Jovi garments, and I assess their skin. Because this treatment is so powerful, I don't use it with patients who have very sensitive and fragile skin, and I always want to check to make sure this isn't too aggressive for them. I certainly would never use this treatment combination immediately after radiation therapy. But the instances where I see an adverse reaction are rare, and in general, my patients are thrilled with how soft their tissues become as they decongest. So now you know one of my favorite treatment combinations. I've really enjoyed sharing this information with you, and I hope that this dual treatment system will be an effective tool for you to use with your fibrotic lymphedema patients. Thank you for your interest and attention.